Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Pharmacists do more than just fill prescriptions. They can dispense advice on the medications prescribed too. Many pharmacies are open late and on weekends, and you don't need an appointment. Today we will talk with two pharmacists about services your pharmacist can provide you. I'm your host, Beth Brown. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. We'll be right back after these messages. Stay with us. Welcome back. My first guest is Monique Doppler, a pharmacist with Mountain Pacific Quality Health, who has many years of experience as a retail pharmacist. Thanks so much for being here today, Monique.
Thanks for having me.
Can we start out this morning talking about immunizations? What can pharmacists do to help us get the immunizations we need?
Yes, so the majority of people know that immunizations are available at the pharmacy. What they don't know, though, is that pharmacists are trained to educate on all immunizations and vaccines. So what that means is if you have any questions regarding immunizations, you can ask your pharmacist. They're a great resource. One thing you do want to keep in mind, though, is when you're getting an immunization at the pharmacy level, there are age restrictions as well as limitations to what immunizations the pharmacist can provide. So you do want to check with your pharmacy to see what they have available.
Okay, great. And there are many over-the-counter medications that we can get either for some common conditions or minor injuries we might have. Can we talk to our pharmacist about our over-the-counter medications?
Absolutely. So pharmacists are very accessible and available without an appointment. So if you do have minor conditions or minor ailments, stop at your pharmacy and ask your pharmacist. They'll be able to tell you if you need to see a doctor, or if they do give you advice about over-the-counter products, they'll tell you when to see your doctor if your symptoms persist. Some common conditions that you may want to talk to your pharmacist about are common cold. You know, if you have runny nose, congestion, fever, ask your pharmacist what would be a good over-the-counter to use. Seasonal allergies are huge right now, so there are lots of over-the-counter preparations as far as tablets, allergy medications, and nasal sprays. You can talk to your pharmacist about acne, constipation, rashes, insect bites, minor injuries, minor pain. So lots of things that you can talk to your pharmacist.
Okay, great. That's good to know. And then I've also heard that pharmacists can help you quit smoking. How can I talk to my pharmacist about that?
Yes, and not a lot of people think of their pharmacist as a resource for smoking cessation, but they can counsel you on prescription medications that are used for smoking cessation, as well as the over-the-counter nicotine products. They're also a good resource to help you establish a quit date, and then set up regular check-ins to see how you're doing, keep you motivated. And then if you have quit smoking, they can assess any complications or challenges you may encounter, you know, if you're having withdrawal or cravings.
Okay, and so another area that people might need some help on and that is often confusing or difficult to navigate is Medicare Part D. Can a person who is struggling with what they understand about their copay and what's covered talk to their pharmacist about Medicare Part D?
Yes, that's a great question. So a lot of pharmacies do offer that service during open enrollment. You can talk to your pharmacist and they can access the Medicare.gov website and enter in all your prescriptions that you're taking, and it'll generate a list of specific plans, you know, that are tailored to the medications you're taking. So you can use that to compare side by side, and it'll give you an estimate of your premiums, out-of-pocket expenses, cost of medications, or any coverage gaps. So you'd want to check with your pharmacy to see if they offer that service. And that's for people that are Medicare D eligible, or if you're on Medicare D and just looking to switch your plan.
Okay, great. And then what about just any of my prescription medicines? What if I have a question about any of those?
Yes, pharmacists are the medication experts. So if you have any questions regarding your prescription, stop and ask your pharmacist. They can help you with medication adherence and compliance, meaning you're taking your medication exactly how it's prescribed when you're supposed to be taking it. They can help you with the proper time of day to take your medication, dosing questions, what to do if you miss a dose. They're also good reference as far as if you're having any side effects or any potential interactions there may be with other drugs. So yeah, any questions you have. I always encourage patients when they're prescribed a new medication, stop and talk to your pharmacist. And I know a lot of times when they're at the pharmacy, it may be busy or you may not have your questions on hand or, you know, in the back of your mind. But when you get home and if you think of a question, pick up the phone and call your pharmacist. That's what we're here for.
Awesome. And you mentioned side effects or interactions, and so we know we need to be careful about the possibility that our medications might interact with one another. What about foods or vitamins and supplements? Do we need to be aware of any interactions that can happen there?
Yeah, that's a great question. There is the potential for interactions with supplements and food. Some really common food interactions that you may not think of are dairy products, alcohol, green leafy vegetables, grapefruit juice, and it can cause interactions on each end of the spectrum. It can cause the medication to have too high of the drug level to be too high in your bloodstream, which can cause the medication to be more potent and cause side effects, or it can be on the other end of the spectrum where the levels of the medication in your bloodstream aren't high enough and you get a subtherapeutic response. So you definitely, when you start a new medication, want to ask your pharmacist if there are any potential food or supplement interactions.
Okay, great. And then what about sunshine? People are getting outside more, the weather's getting nicer. Can medications make us more sensitive to the sunlight?
Yes, that's a great question. They can. There are some medications that are definitely known for causing sun sensitivity. And typically when you get prescribed a medication, your pharmacist will make you aware of that. Some common medications that can cause photosensitivity are topical acne products, some blood pressure medications, or even some antibiotics. So what you want to do is, if you're ever prescribed a medication, you want to make sure that you ask your pharmacist that question. And the best way to manage photosensitivity is by prevention. So that means wearing protective clothing, wearing a hat, staying in the shade, or making sure you're covered in sunscreen.
Okay, great. Thank you so much, Monique. That was a lot of great information. We'll be right back after the break. Please stay with us.